What is it that you know and understand about ADHD that the average person does not?
Well, I think honestly, Chase, the more I learn about it, the more I realize I don't know. Um, I think it's a, you know, it's a topic that is becoming a lot more um, in these days. There's a lot on social media about ADHD, mental health, especially. A lot of people are getting recently diagnosed, adults later in life. I just had a patient the other the other day. I think she was 75, just recently diagnosed. Um, and so, it's an interesting condition, and I've, something that I've suffered from personally, and so I have
Mhm.
that history as well. Um, but yeah, I think what I would to answer your question, what I know about ADHD is that there's not one magic bullet, or there's not one right approach. I think that some people could be more black and white in terms of, let's take medication only, or let's
Mhm.
only do natural supplements or lifestyle interventions, etc. I'm kind of in the middle. I think we're in the age of individualized medicine where, genetics play a role, and our blood work plays a role, and, our family environment plays a role, and our diet, and all these things. So it's not that easy. And so, I think I know that, and I know that it takes sort of a multi-pronged approach to really get sustainable results in just about anybody.
Mm. What is ADHD? Like how is it defined as an actual medical sense? Because high school, middle school, growing up, you always have friends like I have ADHD. It's like, well, okay, is that diagnosed, or are you just saying that?
Mhm.
So what is it actually?
So yeah, the DSM-5, there's basically three different types of ADHD diagnoses, and I would probably argue that there are more than that based on brain imaging. But essentially, we have number one, which is the hyperactive type. That's typically what you would, or what most people think, right? Kind of the typical or stereotypical hyperactive boy in class, getting in trouble all the time, inability of focusing. So that's one type. Secondarily, you have the inattentive type. And so that's more like the daydreaming, kind of spacing out person. And then you could have the combined presentation. So it's basically just, a combination of both for that presentation. So it's, I think diagnosing people has gotten better. I think it's more nuanced. It's more thorough now. Asking multiple people in the family, perhaps, doing the assessment of the person. But essentially it is just, a number of symptoms that we're checking, if we have those or not. And then ultimately, um, lost my train of thought there. Oh, it's basically it's not a condition where we're, doing a lab test, for instance, or we're doing, imaging on, and then we're determining that. It's basically a subjective. And so I think, I like the work of Daniel Amen, who does a lot of SPECT scans, a lot of imaging, and he has come to the conclusion that there are, I believe it was seven different subtypes of ADHD, if you will, based on what's going on in the brain.
Mhm. I actually never thought of like the daydreaming and the spacing out as like a form of ADHD. I've never had like the hyperactive form. Like I've always been able to lock in pretty hard.
Mhm.
I think I might lean a little bit more towards OCD tendencies. That's what my wife always says to me. You mentioned medication and then like more natural supplementation. What is the traditional medication and how does that work and affect ADHD?
Yeah, so we have kind of two different classes, if you will. So one class, or one, I guess, category, I should call it, would be your stimulant medications. Of that class, you have kind of two categories. You have your methylphenidate family. Think of your Ritalin in that category, and then you have your more amphetamine-based stimulant. So think your Vyvanse or Adderall. And then you have your non-stimulants on the other hand. So, and there could be a wide variety of different options there. Your Stratera or your, modafinil, perhaps, various different drugs, your guanfacines, things of that nature. But typically, standard of care is going to be the stimulants kind of first and foremost. Typically for children, more along the lines of the methylphenidate family is kind of first line. And then for adults, more of that amphetamine based stimulant.
Why is it that we would give stimulants to people who are already like hyperactive, unable to focus? How is it that stimulants then make that better?
Yeah, it's an interesting kind of conundrum there. It's counterintuitive. So you're essentially like ADHD. I think of it like and I think other providers have come up with this analogy. It's sort of like a race car engine with bicycle brakes. There's a lot going on. There's a lot of horsepower, and there's not much braking capacity. So with braking capacity in the brain, we think of like executive function and our frontal lobe and our ability to, stop and think and shut down certain actions that we might want to take.
Hmm.
And so that is very dopamine driven. And so when we have a lack of dopamine or a lack of executive function powering that, we're not really able to break the brain properly. And so by giving a stimulant, we're actually giving the brain the ability, or more so, of the ability of pausing. And that's really what we need to kind of calm down in some cases.
Mm, that's interesting. Yeah, that's a good analogy. So the stimulus kind of upgrade the braking ability, and it gives you the ability to slow down and pause and take a little bit more control of the energy that you have. Is that correct?
Exactly.
Okay, cool.
Exactly. For most people. And I think, for some it's not black and white, right? For some people, that can certainly exacerbate hyperactivity if there's more going on, or if there's certain, genetic tendencies that, we could certainly get into, methylation, all that kind of stuff. How are they breaking down neurotransmitters? And so, yeah, definitely not simple. But, that's, yeah, usually what happens or what they're going for.
So what would be the other side of it? The more natural supplementation side. How does that have effects?
Well, I mean, I guess how much time do we have here? um, there's so much there. So like, can you ask that one more time? So in terms of natural supplements, like what's the mechanism there?
More so like what would be the alternatives to the traditional medication that you would recommend, and how do they work in relation to or comparatively to the more traditional medications?
So definitely less powerful, right? There's nothing really that's going to compare to, for instance, an amphetamine-based stimulant. There's nothing natural that's going to achieve a similar,
Hmm.
increase in dopamine and norepinephrine for sure. Um, but what I would do would be more so of optimization of in terms of the gut health, the ability of
Mm,
digesting, things like proteins and then breaking those proteins down to then give the body the amino acids, i.e., tyrosine, to make dopamine in the first place.
hmm,
So kind of correcting some of those underlying imbalances. For some people, it could be supporting, zinc status. It could be
mm,
supporting iron, which are all necessary cofactors in that same kind of dopamine pathway. So correcting some of those underlying imbalances, supporting nutritionally with certain nutraceuticals or supplements, i.e., like tyrosine, right? You're
mm.
literally just giving the precursor to dopamine in hopes that it's then converting over into dopamine. A lot of things as well, it's not necessarily what are we going to add to mimic a stimulant, but what are we going to take away, i.e., systemic inflammation or dysbiosis in the gut, leaky gut, um, all kinds of things can really take a toll. Lack of omega-3 fatty acids, for instance. So those are all going to kind of weaken the dopamine system, if you will. So a lot of it's doing a thorough investigation to understand, where are the gaps in this individual's physiology, and then how do we optimize those gaps? And then we kind of, from that new vantage point, can figure out, okay, how are you now functioning? And then do we need to kind of go another step further here?
Mm,
And I think that depends largely on how that person is functioning in general. So I think there's a wide spectrum of functioning in ADHD.
mhm,
There's some people that can certainly get away with that, just addressing things completely naturally. Like myself, prime example, I was diagnosed and put on a medication immediately, but I hadn't really done any testing before
mhm,
that or any, no questions about my diet, for instance, or my sleep wake set schedule, anything like that. And so over a long journey, I was able to essentially get off the medication and do things naturally, but it requires, some consistent discipline and structuring my life to make sure that those things are optimized so that I am kind of functioning at my best,
mm. Yeah, I
if that
mean,
makes sense.
yeah, I was gonna ask, I mean, you brought it up. How much of this ADHD and other, let's just take ADHD as genetic versus the, the environmental, how much of it is nature versus nurture?
That's a great question. I think there's definitely there's definitely a wide spectrum of functioning, I would say in general. Like I think largely there is a genetic component. We know that certainly. Um, I think that there are things, i.e., social media, constant kind of hitting that dopamine circuitry that's making our attention. We're training ourselves to make our attention worse. That's mimicking ADHD symptoms to a point, but I think a lot of that is genetically driven. And then I think that paired with number one, I think our social media environment, the electronic use and things like that, and the constant dopamine driven behaviors or that dopamine circuitry being kind of hit. And then I guess secondly would be more of our diets and how those have deviated significantly,
Mhm,
from 50 years ago to present and all the packaged foods. And, we can kind of go down that line, but I think that's also contributing significantly. So it's kind of like, there's a lot going on at once that's making those symptoms more prevalent in more people.
mhm. My somebody Andres, he's founder and CEO of Know Your Physio. He was on the podcast, and he had a quote that was really good when he when he was on the podcast. He said, "Just like a driver's license is required to drive your car, he's like a genetic test, a bloodwork test should be your license to supplementation." He's like, so many people just go straight to supplementation without actually knowing what they need or how to apply it, and that made me think of like middle schooler. You got this middle school kid who's, the teacher says, hey, they have a hard time focusing, maybe they need to be on ADHD, but they go straight to these hardcore medications without considering, like you were saying, omega-3 levels, or are they just jacked up on sugary cereals and foods from breakfast? What are the ramifications of these medications? Like, are there any, or is there any downsides to doing them?
For sure. Yeah. I think with any medication, there's certainly no free lunch. You're
Mm,
going to have intended effects and unintended effects.
mm-hmm,
And so, I think of it like an analogy I like to use with ADHD medications is I don't know if you're a car guy, but I think of it kind of like putting a turbocharger on a car. And so if you have a child who's, eating a standard American diet, you know, poor sleep wake schedule, electronic use all the time. It's kind of like the equivalent of, let's say like a 90s Honda Civic engine. It needs some TLC, right? Not
mm-hmm,
really functioning at its best. And then you go slap a turbocharger on that. It's like you're upregulating metabolic demand, all this stuff. And it's like what happens when you do that? Well, you would probably expect some level of pressure on that engine and then things to start to break down eventually. And that's typically what happens is the medication use without the prior foundational groundwork
mm-hmm,
um, can lead to even more nutrient deficiencies, more imbalances that then turn into a vicious cycle that those imbalances or those deficiencies make the ADHD worse.
Mm,
And then typically what happens is then providers unfortunately may increase the dose to try to, achieve the same effect. And then it just becomes this vicious cycle. So
mhm,
in an ideal world, sure, I think I would agree with that gentleman 100%, right? And that's the treatment that I never got personally was to do the deep work, do the genetics, do the blood work, do the stool testing, what have you, and then try to establish a better foundation first. And then if the time comes and we're still not achieving those results, then would be a better time to medicate because then you're going to have a stronger engine or a stronger system to
mhm,
sustain that turbocharger. Um, and I think you're going to encounter, I mean, I know you're going to encounter a lot less side effects potentially from that, a lot less nutrient deficiencies since you
mm,
would be repleting those beforehand. And
mhm,
then also, while you're on the medication, for instance, like magnesium is one of the top ones, right? That's often deficient in just about anybody, but even more so in those with ADHD, and then even more so in those with ADHD who are on stimulant medications.
mm,
So we kind of have to know that what these medications deplete or how they upregulate the system so that we can do a better, more proactive job at repleting those. So we're
mhm,
not running into that vicious cycle.
mm. The stuff that we're talking about today, we've been talking about specifically, ADHD and ADHD brains. The nutrition side of things that we haven't dived into yet, the health and wellness side of things that we haven't dived into yet. Is there anything that is specific to the ADHD type brain that the non-HD ADHD person could benefit from? Or like, is it all just kind of hand in hand and the ADHD brain benefits a little bit more from certain things? Does
I
that make
would
sense?
say so.
Yeah.
I think the advice that I give, on social media or to patients, it's going to be helpful for just about anybody. I think those
Hmm.
with ADHD are have a lot less uh room for error, so to
Yeah.
speak, physiologically,
Hmm.
whether it's their response to glucose, for instance. You know, eh, I think that yeah, it's generally good advice, I would say
Mm.
well, not always. I would say not always, depending on the condition or what's going on, but generally speaking, yeah, eating a whole foods diet or Mediterranean-esque diet, omega-3 fish oils, optimizing blood work, and so on.
Mm.
That's gonna be, yeah, beneficial for just about anybody.
Well, then let's talk about the base of this health and wellness. Where should we start? Nutrition, sleep, exercise, supplementation. What's the base?
I think all of that, right? Um, it depends on, just how I work with people, um, what are those areas that what are they most excited to change? What are
Mm.
they most willing to do differently? Starting there because I think there's many on ramps to optimizing your health. All those things that you just mentioned are incredibly important. So the question is, what is that person individually more, excited about, or how do we start to build that positive momentum? For some people, and a lot of times too, when I'm making those calls, it's like, how can we hit multiple birds with one stone?
Mhm.
For instance, like for some, a child, okay, might be lacking some social skills, might be struggling with ADHD, they might not be exercising too much. And it's like, okay, maybe a team sport like, tennis or
Mm.
Brazilian jiu jitsu could kind of hit a lot of those things simultaneously.
Mhm.
So that's really kind of the magic of it is what are maybe some of those needle moving activities for that person that I
Mm.
think could address multiple factors to really move things along and create some positive momentum to then start to address the other ones, right?
Mm,
Like diet or like sleep, stuff
mhm.
like that.
What about for, let's just say we have a blank slate of a mid 20s to early 30s type of guy who comes in and he says, Dan, I've been watching a lot of Brian Johnson, the Don't Die guy. He's like, I want to get as optimized and helpful and healthy as possible. He's like, I'm here for, 20 minutes. I want you to build me like a pyramid, a template. Where should I start? Should I start with
Mhm.
sleep? How do I optimize that? What's the general bottom of that pyramid?
Well, um, so yeah, I mean, well, right there, actually. So a quick side note here. Each of my initial visits are about 80 to 90 minutes, just to give you an
Mm.
idea. So the 20 minutes never would happen in my
Never
office.
happened.
But but with that being said, I think, creating a solid sleep wake cycle, so the circadian rhythm, or our natural 24-hour
Hmm.
biological clock, incredibly important. So I think a lot of people in that age, in the, early 20s, mid 20s or 30s, they might be going to bed at the same time during the weekdays and then kind of staying up much later on the weekends or drinking on the weekends. So with ADHD, that's one thing that is also different genetically speaking, is there's a higher propensity of having what's called a delayed circadian rhythm, or a delayed sleep wake cycle. So that normal sleep wake cycle, right? It's normally we get a cortisol spike in the morning when we wake up, and then that gradually declines, and then melatonin rises, to put us to sleep, obviously.
Hmm.
So with ADHD, that cycle could be delayed several hours, which can make it incredibly difficult to fall asleep, to wind down at night. And so we have to kind of proactively manage the bookends of our day, both what we do in the
Mm,
morning, i.e., getting light, getting exercise, getting movement, and then on the flip side, eliminating blue light, especially, right?
hmm.
Eliminating, you know, eating, food too late at night, for instance,
Mm,
being mindful of activity. So I think that's probably something that I really commonly see people just scrolling at night before bed, or on, working too late on their computer, on their devices. And that can be incredibly disruptive to that sleep wake cycle,
hmm.
which a lot of things are dependent on, without getting too much into the weeds, but a ton of things physiologically are dependent on that sleep wake cycle kind of firing on all cylinders and being very regular.
Hmm.
I think protein in the morning and consistently throughout the day is another huge one that I would say
Mm,
for just about anybody, but especially important for those with ADHD.
hmm.
So having, protein in the morning, typically, I would say, I mean, some people, of course, the intermittent fasting and things like that, but I would say generally speaking, for most people, having some kind of protein in the morning and then periodically throughout the day is going to be very helpful, right? That protein is going to contain tyrosine, the building block to dopamine, and then it's also going to be very helpful for balancing blood sugar. So with ADHD, if we're number one, if we're going to bed late, we're going to be waking up late, we're going to be rushing in the morning. That's going to
Hmm.
kind of set the stage for potentially skipping breakfast, running on adrenaline or coffee only. So it's kind of this spiral that happens. And so we kind of have to start with those basics and
Hmm.
really have that circadian rhythm and that structure
Hmm.
down to really set the stage for the other habits to take place. Um, I think avoiding sugar in general, or too high of a carbohydrate diet. I mean, I know you train a lot. I think it's different if you're training a lot intensely, kind of peri workout, before, during, or right after the workout, more susceptible to taking up that glucose more readily. But generally speaking, kind of relying more on the proteins, the vegetables, the lower
Hmm.
sugar fruits and stuff like that. Um, what else? And then I think, yeah, like the blood work, doing an assessment of where are your gaps
Hmm.
nutritionally or hormonally or inflammation wise, blood sugar wise, and then addressing those accordingly.
Mm. I think it's when people talk about improving their sleep, they are always looking for, the supplementation, like give me the magnesium bisglycinate, give me the blue light blocking glasses, give me, the X. But
Hmm.
it's so funny how heavily consistency, like the body's a creature of habit. Like if you can have a consistent sleep and wake cycle, that's like the number one. Like you'll fall asleep so much better, you'll wake up feeling a lot better. So I always put that as number one. Like if you can have a consistent sleep wake cycle even on the weekends, that's number one, and then you can start to add in these other things.
100%. Yeah, I mean, I think on that same note, a lot of people talk about the morning routine or the morning ritual. I
Hmm.
think equally or even more important would be the nighttime routine or wind down, actually setting an alarm to
Yeah.
go to bed, or to
Hmm.
start winding down, because that really sets the stage for you getting adequate sleep and then feeling well rested earlier in the morning, waking up on time and kind of,
Hmm.
starting things on the right foot.
Hit us with yours. What's your nighttime routine, your wind down?
Wind down, well, I have lighting is a big part of that. And
Mm.
so we have particular lighting in our bedroom, like a salt lamp, and then we have a lamp that's a low lux, I believe. Um, so you really want to try to get rid of like overhead lighting, about the hour before bed, start
Hmm.
to turn off the electronic devices. If I happen to be working late, which I really try not to do, 'cause since I know what it's doing to me, I have that free app on the computer called f.lux. It's a download that basically will eliminate much of the blue light exposure from the screen. I also wear blue blocking glasses as well as kind of just an extra shield. And so, I'll be just hanging out with my fiance. We'll be talking. I'll be reading, try to read a physical book, for a
Hmm.
change. Um, and just try to wind things down that way for about that last hour.
Yeah. I I have one as well. Not to sound hypocritical to my wife when she's listening to this. I know I'm off my routine right now. I'm sucked into these stupid little audiobooks right now. So I'm like having my phone in bed. I'm like listening to the stories late at night. So I know I'm off. But my ideal routine is, yeah, you're exactly right. Like 2 hours, hour and a half before bed, my phone comes into the office, like plugged in into the charger,
Nice.
that's in a different room, and then I physically turn it off, because I know in the morning if it's like if it's easy to just grab and turn on, I will. So like physically having it off, I won't just check things.
For sure.
And then I turn off my overhead lights, and I just turn on like these warm like lamps. So we have a couple lamps. And then
Mhm.
I also wear blue light blocking glasses, but not like the thick orange ones. So they're like super orange.
Yep.
And then I'll take some magnesium bisglycinate before bed.
Mhm.
And then I'll cool down my apartment to like 67, 66 degrees. And then I too will read. I do use a Kindle though, just
Mhm.
for ease of use. I'll
Yep.
turn it super orange still, but like being able to just reduce the frictions, like being able to have the lights low and be able to see, because my eyes struggle in the dark. So yeah, I'm the
For
same.
sure.
Like having a pretty consistent sleep routine is pretty valuable.
But yeah, no, it sounds like a killer one for sure. Yeah, I'm also taking the magnesium glycinate before bed. That's been a game changer for me, taking that for years. The cooler environment. Yeah. And then I think we've got some blackout curtains as well.
Hmm.
That's an important thing. And then I think for
Hmm.
a lot of folks too, just that even a little bit of light exposure from, the little light on the TV or,
Yeah.
the alarm clock, just, stuff like that you wouldn't really think about. Studies show that inhibits melatonin release to a certain
Yeah.
degree. Just even a little bit of light. So, we try to, tape over or, put something over anything that might be emitting any kind of light exposure.
Hmm.
Um, but yeah, I think a lot of it too, you brought something or I thought of something as you were saying that. It's like a lot of this stuff is setting up your environment in a way that it makes these habits very easy to do consistently, like having the blue blockers right by your bedside table or thinking through this, like how are we gonna have our lights or what are we gonna buy? Having the magnesium right on your bedside table. I
Hmm.
think that's a huge piece that I've gotten more into, like recently, is how do you kind of automate these
Yep.
processes to put them on autopilot so you like for instance I've got this huge standing desk here that I've got a treadmill here so oftentimes in the morning if I'm not if it's cloudy or if it's raining outside I'll come in here put the treadmill on. I've got my sad light right here for some light exposure. um, I've got a Juve here for some red light.
Mm.
So it kinda got the setup going, so I literally just takes me less than a minute to set this all up because it's already here, and then I'm good. I've got my light exposure, I got my morning,
Hmm.
routine, my exercise going, and, yeah, I think it can make a world of a difference.
I think it was James Clear, yeah, from Atomic Habits. Like, we don't rise to the level of our goals, we fall to the levels of our systems or whatever. So just having systems in
100%.
place to make it super easy, and that's something I preach. And I was talking to my friends about this the other days. Like, whenever you're motivated to make a change, you often plan for always being at your best day. Like, I'm always going to do this, I'm always going to do that. And I always say, like, plan for your worst day, because like if you can do what you can do on your worst day, that's going to be the consistent stuff. So don't be like, oh, I'm gonna turn my phone off 3 hours before bed and all my lights are going to be off, and I'm going to carry like this red little flashlight around. It's like, that's not realistic. Like, try to make it
Yep.
realistic, and then you can always just add a little bit more down the line.
For sure. For sure. Yeah, I couldn't agree more. Yeah, I just made a YouTube video actually about that, like a morning routine and the idea of having three different versions of it.
Mm,
Like number one, like you're just saying, like an
cool.
ideal version, I'm feeling great. I'm gonna do, all this stuff. I'm gonna meditate, I'm gonna, all this, and then kind of a average day mentality or average motivation level, and then kind of at your worst. So I think another part of that also for people and I think with ADHD, they're especially prone to starting things, being really excited, and then just falling off like 2 weeks later. You're having an intense interest and drive, and then just, things just kind of fall by the wayside. But a lot of that is knowing that, and then exactly like you said, just planning for the worst and having that net there to catch you when inevitably you will fall. And then I think by doing so, that really helps to keep some level of momentum going. So you're
Hmm.
still in that video, for instance, you're still doing a morning routine. It's not the Mac Daddy or the full song and
Yeah.
dance, but it's still something. And so I think psychologically that does a lot for us when we're still doing something. We're still moving the needle forward and we're not breaking that chain. And so
Hmm.
then it becomes a lot easier to continue the next day and the next day.
100%. As somebody who's always been like, oh, if I'm going to do this, I'm going to do this to the best of my ability and the ability that it can be done. Like, that's always been my philosophy. But the reality is, like, you can't. And so you fall off. And then because you fall off, you no longer did it to the best of the ability. And because you didn't do it perfect, why even try? And then it's just a
Exactly.
perpetual cycle that fails. So yeah, it's been a learning process over the past couple of years that I've had to really do and shift, is like
Hmm.
exactly what you're saying. It's like, even if it's minimal, I'm still checking the box and I can put the X, make the chain. So like the next day when I'm feeling more motivated, I can look back and be like, oh, I still made progress. It wasn't like a complete failure. I didn't stop. I didn't do nothing. I still made that little bit of change. Talk to me about
Yeah.
your morning routines. What are you doing there to optimize your day?
Yeah, so typically waking up generally around the same time.
Hmm.
And so wake up, I typically will meditate soon after waking up. So let the dog out, I have a little mat that I kneel on and then I typically use the Muse, which is a biofeedback device. You kind of just put it on. It's like a little band that goes on your head and it's a kind of like a crude form of neurofeedback. It's an
Hmm.
EEG. And so basically you meditate and then based on how the meditation is going, um, the device will, you'll hear birds chirping if you're in that alpha state of, brainwave activity. And then, more noise if you're not. And so that's helpful for me. It kind of gamifies the meditation process. Sometimes I'll use it. I would say most of the time I'll use it. Sometimes I won't. But meditation will be first. After that, I typically like to go outside, or sometimes I'll meditate outside. So we've got a great, backyard here. So I'll go out, try to get some sun exposure.
Mm,
And then usually I will walk or, take a short jog just to kind of
mhm,
get the blood flowing. That makes a huge difference for me. And I think a lot of people,
mm,
just to give the brain or have the brain generate more dopamine and norepinephrine so I'm not seeking it on my device, going to
mhm.
social media or going to emails immediately. So I make it a rule to not look at or not turn my phone off of airplane mode for probably the first good hour or so after waking up.
Awesome.
Um, so I don't do that. I'm not looking at emails. I'm not being in reactive mode. I'll then take a look at, and even I like to just listen to my goals and kind of affirmations that I have. And so I have them in my task management and I just have my phone read that to me. And so,
Cool.
as I'm walking around or doing whatever in the morning, I'll then listen to some of those goals, higher level goals, uh, medium level goals or medium term goals, short term goals, some affirmations. And then, yeah, typically, sometimes I'll be reading. I like to read, I'm a huge reader. Um, or, and then planning the day. That's a big one. So, kind of
Mhm,
thinking back on or looking over what are the longer term goals? What are the medium term goals? Kind of what are the weekly priorities? What are the daily priorities? And then trying to map out the day in terms of what's most important and then literally blocking that into the calendar. So I'm then having that visual representation of here's my day, here's what I'm
mhm,
doing, here's what's most important, and then making sure that those things are, to the best of my ability, aligned with what I've said is most important to me and what are my goals and trying to live in that alignment.
mhm.
So yeah, that's the start.
You mentioned earlier you've got, 3 levels of morning routine. What does it look like when you're on your off day? What are your non-negotiables that you just have to check off in the morning?
It would be a shorter meditation. I think just grounding, connecting with yourself spiritually or with God, with creator, what have you. I think that's first and foremost. Secondarily, morning sun exposure, even if it's just a couple minutes, and then a couple minutes of some kind of exercise. For me, like a condensed version would be coming upstairs, getting on the treadmill, so then I can kind of plan my day as I'm on the treadmill. Um,
Mhm,
I think that's, yeah, something like that. And then soon thereafter, I didn't mention, I typically will then have a pretty nutrient dense smoothie, a lot of
mhm,
protein in there, antioxidants, stuff like that, organic blueberries. So I'm then hitting the light exposure, hitting the connection with source, hitting the exercise, and then kind of mapping out the day. And that might look a little more simple as well. Like, what are the priorities for today? Maybe it's not five different things. Maybe it's, two or three priorities for
mhm.
the day.
High protein, nutrient dense breakfast. What is the benefits outside of building muscle? What the macronutrient protein, does it provide more than that? What else are we getting from it?
Well, it provides a lot of satiety.
Mhm,
So, with ADHD, or, just about anybody, if we're if our and so satiety and then blood sugar stabilization, those kind of go hand in hand, where
mhm,
it's then making us feel full longer and balancing blood sugar longer,
mm,
versus if we have something just carbohydrate, think our typical like bagel or something like that, or
mhm,
just cereal. We're going to get a big spike and subsequent crash of blood sugar soon thereafter. And then our hunger typically comes back, 2 hours later,
mm,
we're starving again. And so those two things I would say, so satiety, blood sugar stabilization, the amino acids building blocks for, our branch chains, of course, for muscle building, but then our tyrosine for building dopamine. Um, yeah, it's a critical one for sure. Critical
Mm.
one.
What are some things that we should be including in our diet to get the most out of it? I know a lot of times we have an incomplete micronutrient profile. We're often missing vitamins and minerals due to a lack of diversity. What are some things that you would suggest to help cover those gaps and some foods that we should include in our diets?
I think the more colors we have, the better. Like we, especially in the States, we tend to have a very bland, like white bread and, just not much color, a lot of
Hmm.
packaged foods and stuff. So, with each color comes different micronutrients, different phytonutrients. And so I think, protein first and foremost, obviously, whether you're plant based or, eating animal products, the quality of those incredibly important. Um, and so, whether that's eggs, very nutrient rich, choline, omega
Hmm.
3s, et cetera, protein, healthy fats in there. Our lean fish, high omega 3 fats, extremely anti inflammatory, very healthy for the brain. We're trying to go lower on the food chain, so smaller fish to avoid the larger, mercury, heavy metal accumulation
Hmm.
that is inherent in fish that are just in the ocean longer. Um, I think from a vegetable and a fruit standpoint, really the more the merrier, especially on the vegetables, not so much on the fruit. Lower sugar fruit that is. So, a lot of like cruciferous green vegetables, spinach, we're going to get our, folate, some of our, at least our non-heme iron from spinach and other green leafy vegetables. We're going to
Hmm.
have that fiber that's essential for, again, blood sugar stabilization, similar to protein and satiety, and then gut microbiome diversity, helping to kind of bind and excrete LDL cholesterols or bad cholesterol from the body.
Hmm.
Those are super, super helpful, very filling too, very nutrient dense, but not very calorically dense.
Hmm.
So very helpful for kind of, keeping our weight at optimal. Um, our fruits, our berry family, I'm a huge fan of those. Blueberries, organic, definitely those are typically heavily sprayed with
Hmm.
pesticides. So going organic is definitely, I think, worth your money on those. Getting them like, for instance, at Costco, in bulk, organic, frozen,
Hmm.
can be a cheaper alternative for a lot of people. So getting your colors there and then kind of trying to stay away, I would say, more so from your higher sugar fruits, especially like your dried fruits. They pack a
Hmm.
huge sugar punch.
Yeah.
They're easy to kind of overconsume.
Hmm.
Your like bananas, mangoes, pineapple, stuff like that, just more in moderation since they do contain higher amounts of sugar.
Hmm.
And then, your kind of more starchy carbs. So I'm not a huge fan of gluten for a number of reasons, for a lot of people, but our, things like our quinoa, our, rice, our
Hmm.
sweet potatoes, regular potatoes, s- you know, um, what else? Squash, beets,
Hmm.
stuff like that. So yeah, basically very, very whole food in general.
Yeah.
As low amount of processing as possible, packaging as possible, just as close to kind of Mother Nature as you can get, the better.
Mm. So do you have like a go-to morning smoothie that you hit? What's in that?
I do, yep. So I
Huh.
do like an organic plant-based protein powder. Um, I'll do
Why do you
some
skew
organic
why do you
cacao.
skew towards the plant-based versus like a whey protein or something like that?
Sometimes I will do a whey protein. You're gonna get the plant-based protein that I use does have some added branched chain amino acids. So that's
Mm.
kind of the key when you go more plant-based. It's not necessarily like if something plant-based has 1 gram of protein, it's not necessarily a 100% equivalent to, 1 gram of
Mhm.
protein from steak or from whey protein. It doesn't work like that. So you
Mm.
kind of have to adjust for that, as a side note. But yeah, I generally like that one. I will switch.
Mm,
I don't typically do too much dairy, but whey, you are kind of bypassing most of a lot of people do have problems with the casein, which is a
mhm,
different protein in milk or dairy, which, they're extracting just the whey protein out of that. But yeah, sometimes I will certainly do whey. And then, yeah, cacao powder, organic,
mm,
just for the high amounts of something called OPCs in there,
hmm,
which are very helpful for the brain. Um, I'll put in some, like I said, the organic frozen blueberries. I'll usually put in just some pre-chopped frozen avocado as a fat
mm,
source. It's very easy to just dump in there. Some uh what else should I put in there? Um, Maybe like a dollop of almond butter or cashew butter,
mhm,
maybe some walnuts in there for some additional fats. I'll put in perhaps some fiber, like some psyllium husk for extra fiber. Sometimes I'll put in like some organic riced cauliflower.
hmm,
Might taste a little gross or might seem a little gross, but you literally don't taste it at all. It's just kind of adding in some more plant material, some more fiber in
mhm,
there, maybe some frozen spinach, stuff like that.
mm.
That's about it.
I've been on the beef protein game, so not like
Okay.
not a whey, but the actual beef isolate. I've been using Equip Foods.
Okay.
It's
Not
been pretty
familiar.
good. Uh, my wife I guess doesn't handle the whey very well, and I was like, okay, well, let's get you a protein that you can handle. So we moved over to the beef protein. It's been good flavor, good
Yeah.
stuff.
I don't think I've tried that, but I might have to give it a whirl.
So, how much of your diet includes animal-based or animal foods? Because this has been a theme for me that I've started to realize, like, hey, I don't think anybody really knows 100%. Because I've had Dr. Anthony Chafee on, who's like a big proponent of like straight carnivore, like he only
Mhm,
eats that. And then I've had Dr. Joel Furman on, who's like, hey, less than 5% of your daily calories should come from animal-based foods, and he's purely doesn't eat any animal foods. And
mhm,
then I've had like Dr. Bill Schindler on, who's like an anthropologist, and he talks about how he's more in the middle, but your vegetable or your plant-based foods need to be a little bit more processed, so like fermented and things like that. So I've
mhm.
it's all just thrown up in the air for me. I just do what I can.
Well, I think, yeah, there's probably, you know, weight to all of what those people said. I think it depends also on just individual, you know, your own genetics, what you process, what you do the best with. Gosh, I know I think there was some stuff in like the different if it was Ayurvedic medicine or different forms of medicine kind of coming to the conclusion that some people do better generally with more plant-based diets or more
Mhm,
predominantly plant-based versus more animal-based. Typically do better with some kind of animal protein in the diet.
mm,
I've tried the other way for several stints.
mhm,
It didn't really work out too well for me. Cognitively, energy wise, just overall vitality just didn't feel as good.
mhm,
Um, I think there's a variety, but I think that I forget who you said, the last gentleman there of, fermenting the foods. I think uh, there is something to that, making the foods more digestible,
mhm,
trying to get rid of as much of the plant defenses as we can, lightly steaming them, things like kale, for instance, steaming them, draining the juice out. So I think there's something to that. I probably eat, a large amount of plant matter in my diet. I think there's a lot. I'm not a fan, I would say, of the carnivore diet, at least long term. I think
mhm,
I'm a fan of that more short term as a therapeutic diet where we're
mhm,
removing a lot of things, a lot of processed foods, a lot of, grains or lectins and things like that from the diet. So we're kind of starting with a clean slate and just allowing the digestive system to heal and to give it a break.
mhm,
Um, but I don't know. if anybody really knows the long-term ramifications of that, generally, health-wise or microbiome-wise or what have you.
Yeah.
Um, yeah, I don't know how good of an answer that was, but I think it kind of depends. Try different things out.
Yeah.
See what really works for you. Measure your blood work as well. See how things are trending. I mean, I've seen some horror stories. People on the carnivore diet coming in where they're genetically, LDL or LPAs through the roof. They're
Hmm.
just genetically a lot more um, susceptible to having higher levels of lipids in their bodies, for instance.
Hmm.
It's just, and then they're perhaps also adding to that fire by eating more like pro-inflammatory, not very quality meats and things like
Hmm.
that. So that's also another thing too, where
Hmm.
high inflammation and high lipids, um, terrible combination in general. But
Yeah.
yeah.
I think that was the best answer because talking with Brian Sanders, with like he has a saying. He says, "Camp no camp." It's like as soon as somebody's in a camp, like they have to interpret and defend their ideology based off of the data, and so they'll find the data that
Hmm.
they like that defends their area and not look at the other stuff. And so yeah, I'm kind of in that same boat. I'm camp no camp, just like trying to do what feels best to me, what allows me to do best, and everything in moderation. So yeah, I love,
Hmm.
I'll eat some good quality red meats, and then I'll eat some animal, or then I'll eat a lot of plants as well, and fruits and berries, and it's all great. Is
Hmm.
there any things that you recommend that really move the needle for the health and wellness in terms of like third party, or like a sauna, or any actual gadgets or things like that that actually help,
Hmm.
that you recommend?
Yeah, I mean, I think the research on sauna and cardiovascular health, mental health, all cause mortality is
Yeah,
overwhelming at this point. So for
100%. Yeah.
sure, a sauna, um, you know, things like cold plunging. It's yeah, it's interesting. Maybe I should bring this up. I think with some of that stuff, a lot of patients come in to see me and they're cold or they're saunaing for, an hour a day, cold plunging for,
Yeah,
20 minutes. Yeah. It's like
it's a lot.
there also is too much of a good thing too.
Yeah.
So I'll just put that out there. But yeah, I think the sauna in general, a couple times a week or what
Hmm.
have you. I think the research is pretty clear. The more the merrier, essentially to a point. But um let's see what else devices wise. I think, red light therapy could be very effective. I think I'm a fan of neurofeedback or some kind of biofeedback, whether that's heart rate variability training. The Heart
Hmm.
Math Institute has some great products like the M Wave, or they might have had, I think there's a new one, I don't know what it's called. Um, where you're recognizing these would be unconscious processes, and you're making them conscious, and then you're
Hmm.
able to kind of more control them. So I think the HS, or sorry, um, HSCRP, HRV, heart rate variability is a helpful one to train. And I think neurofeedback can be incredibly helpful as well. Although it's not as common, but
With
helpful.
heart rate variability, that's not something you can specifically train, right? Like that's improved by increasing like cardiovascular, doing longer zone 2 runs, or longer high intensity runs, right? Then it seems that HRV also increases as that increases, or is that incorrect?
Both. Both
Both.
could be true. Yeah. So when you train HRV with a device, for instance, like the M Wave, I believe it's you hook it up to your ear, and then that device hooks right into your phone or computer,
Mhm.
and then you're through a series of breathing techniques and conscious awareness and biofeedback, then you're able to recognize when you're in fight or flight, and you are able to train that
That's cool.
down
Hmm.
into more parasympathetic over time. And then similar to like, having training wheels on your bike, you sort of learn, oh, okay, like this is what it takes to to drive the bike straight, to
Mm.
be in parasympathetic mode. And then to a certain extent, that analogy carries over to heart rate variability training, where you're using this device to kind of realize, okay, I am in this state, and then to carry that over into daily living. But yeah, I think the training for sure and the sleep and all that stuff is going to help tremendously as well.
Yeah, I was gonna say because like wearables have made it so synonymous with just like sleep. Like you look at it almost passively than you do actively.
Definitely both. Yeah, definitely
Yeah.
both. I mean, I think 100%, sleep has a massive impact. And so does your
Hmm.
diet or, caffeine intake, stress levels, etc. But I think simultaneously, both can be true and are
Hmm.
true, where you can go in and, have like, I remember, gosh, I think there was a couple of years where I was doing that, 10 minutes a day, every day to really train that system. And it was profoundly helpful.
That's cool. Because like I wear Whoop, worn a Whoop for a while. So like you wake up in the morning and we give you like a recovery score, and obviously there's a many factors that go into it, but one of them is very effectively your HRV in relation to what it usually is if it's high or low, and
Hmm.
so you usually people who wear these they then associate HRV with just like kind of like a passive, like, oh, this goes down because I'm overtrained or underslept, or then it'll go up
Hmm.
when I'm ready and stuff. But they don't think about the fact that you can actually train that through those things. Did you notice a noticeable change in your base level HRV or anything like that?
I don't think I did wear an Aura ring for a number of years.
Mm,
I don't think I was wearing one at that time. So I didn't know what my baseline was while I
mm-hmm,
was doing the training. I think it was before that stuff kind of came onto the market.
mm,
Um, but yeah, I think, um, yeah, I think, regardless of your training, if you sleep poorly, 100% your HRV is going to go down no
mm-hmm,
matter what, So, it's just, yeah, from that baseline, I think that is very relevant. But at the same time, for a lot of people too, like it depends on, just like in functional medicine or the medicine I practice, what is root cause medicine. So
mm,
I think there are many root causes for why HRV might be in the tank. One of
mm,
them might be sleep, one of them might be overtraining, one of them might be your job or your responses to the stressors of that. And
mm-hmm,
so that's kind of mitigating or training one aspect of that, which is your own nervous system response,
mm-hmm.
if that makes sense.
When people come to you and for your kind of insight or help or improvement, what are they usually looking to improve? Like, is there a typical kind of customer base that you have?
I would say, interestingly, it's primarily parents of
Mm,
children with ADHD that come in
mm,
to me, and they're navigating this arena of, I'm getting write ups from school.
mhm,
I'm kind of at my wits' end at home. Things aren't working. There's a lack of focus. Eh, you know, I'm being told I need to medicate my child. What are the other options, kind of thing? Like, we've never done any of the testing that I talk about, or
mhm,
any of these other alternatives. So I would say a lot of people, a lot of it's parents that come in.
mm,
And then I think it's just a lot of people in general who come in with ADHD primarily, like that's what gets them in the door. They're
mhm,
resonating with that content. But I think it's this general desire for root cause medicine and addressing things more holistically.
mm,
And so I think, for just about anybody as well that comes in, they might come in with ADHD, but they might also, and usually do also, have 5 or 10 other things that are going on that are out of whack. Maybe that's hormonal imbalance, maybe that's
mhm,
gut health issues, maybe that's, X, Y, or Z as well. And so I really can't have the blinders on and just focus on the neck up, the
mm,
ADHD only. It all, in my opinion, all relates. All those body systems relate to each other, some more so
mhm.
than others. But yeah, that's I would say the vast majority.
What are the tests that you're starting with for all of your new patients?
It's individual. I think based on that initial visit helps to determine what I think is out of whack, and then we'll test those areas. But I think for just about anybody, just generally speaking,
Mhm.
things like vitamin D, a CBC or a complete blood count, taking a look at white blood cells, red blood cells, the size of
Mm.
them, the differential, the different types of white blood cells and the ratios. Um, comprehensive metabolic panel, looking at kidney and liver function, electrolyte balance,
Mhm.
protein, um, taking a look at markers such as iron, a full iron panel, right? Not just serum iron, but
Mm.
also ferritin, which is our storage form of iron and typically the first to decline if we're deficient in iron. A full thyroid panel. That's typically never done in conventional medicine, even by most endocrinologists. They'll basically just run uh, hopefully I'm not going too much into the weeds here for your audience,
No.
but typically just like a TSH, which is kind of a screening marker, that's just how the brain is signaling the thyroid to make thyroid hormone with maybe a reflex to a free T4, um, which basically just means if the TSH is out of range, then we do a free T4.
Mhm.
Um, in that context, I would want to see a free T3 as well, which is almost never done. And that's the active form of thyroid hormone.
Mhm.
So there's kind of like just to play that pathway out, there's sort of multiple things that could be going on that usually aren't even tested for. So it's just the one marker that's tested for, like TSH. And then of that, that's typically only or that reference range could be quite wide. And so
Mhm.
that could be considered normal, even if it's very suboptimal. And then the other more kind of fine tuning markers are really never done. Um, so, I mean, same
Mhm.
thing goes like, for instance, like for measuring testosterone, right? What is total testosterone, but what is your sex hormone binding globulin? And what is your free testosterone? And what is your
Mhm.
testosterone to estrogen ratio? And what is your ratio of total to free testosterone? What is DHEA sulfate? What are the signaling, for instance, like in a man's case here, like luteinizing hormone and follicle stimulating hormone, like the signals that the brain tells the testes to make both sperm and testosterone. So at any one of those points there could be kind of dysfunction.
Mhm.
I know I kind of got a little sidetracked here with the question, but um I think that's important in terms of, I guess the point of me saying all that is the thoroughness of the investigation to know more specifically where is there dysfunction in what pathway, and then how do we more granularly take care of that or address that. Because
Mhm.
I think a
I
lot of
know.
people too, or and I'll end on this note, but I think a lot of people will say, "I went to my primary care, everything looks normal," right? "Quote unquote normal," right? But it's like very minimal labs were done, number
Mhm.
one, and then number two, the reference ranges are very generous, and so that doesn't mean a
Mhm.
whole heck of a lot, right? So normal in conventional medicine just means the absence of overt pathology. It does not mean you're in optimal health.
I know you said a lot of this is case by case basis but not a lot of people would have access to, a provider who can do these. Are there any like at home blood testing kits that you recommend that are good?
There are, yeah, actually, to solve that problem, I did just spend a ton of time building a lab assessment guide, like a PDF, with an associated ability for somebody to order their own labs through a company. So maybe you can link that. Yeah, it's something I'm proud of. It took a ton of work to do that. So I think that's one thing. I know there are more companies now that go in the States and worldwide that go direct to consumer. You can order
Mhm.
your own. Like I know Function Health is a big one, Mark Hyman's company.
Mhm.
There's others on the market as well. But yeah, I think the lab guide would be a good place to start. Kind of where I explain what those common markers are, what the typical reference ranges are, and then what the more optimal ranges are, and
Hmm.
then what those labs mean in the context of ADHD specifically and why they might be important.
Dan, I like to close off every podcast with two closing questions. The first being, who do you think I should speak to next and why?
Hmm. I think I really like Dr. Storage. He's a psychiatrist. I believe he's in LA, the LA area. Um, I really like his stuff. We kind of have a similar philosophy. I know he does a lot of brain imaging and SPECT scans. He's at the Amen Clinic, one of the Amen clinics there. And so I think that's another valuable piece that I haven't really gotten into very much. I've done more of like the QEEG brain mapping from a
Hmm.
neurofeedback standpoint, but not necessarily the neuroimaging. And
Hmm.
also from psychiatry with more, more of the med management specifically. Um,
Hmm.
I think that that would be a great, if you want to explore ADHD more in depth, I think he would be a great one for sure.
Second question is based off a Ralph Waldo Emerson quote. If we encounter a man of rare intellect, we should ask him what books he reads. What's a book you'd recommend for me?
Um, let's see. So many good ones. I think one of my favorites is an old one, but a good one. It's called Psycho Cybernetics by Maxwell Maltz. Have you ever heard of that one?
I have not.
Okay. So he was I think back in the 50s or the 60s, he was a medical doctor, a plastic surgeon
Uh huh.
before plastic surgery was a thing. It was, basically just these, bodily injuries, and he would try to, reconstruct the face or the parts of
Hmm.
the body. Um, and basically, the premise of the book was what he found was that a lot of times the self image of the person really dictated um, how they would respond to surgery. Basically, some people could be totally, put back in shape and then still mentally not feeling very good about themselves, essentially. And so, um, it's
That's cool.
kind of like a classic self-help book, but it talks a lot about just the power of the mind, visualization, and things like that.
Hmm. Yeah,
Um, yeah, it's one of my favorites.
I'll have to check that out. Yeah, I'd never heard of that. Psycho Cybernetics. So,
Yeah, Psycho hyphen Cybernetics, Maxwell Maltz. Yep.
cool.
Interesting title.
Yeah. Awesome,
Yeah.
Dan. Well, again, I appreciate your time. Where can people follow you? Where can they get more of your work?
Sure. Yep. I'm pretty active on Instagram, dr.dansullivan. And then yeah, I think that's the main place. I am doing more long form YouTube videos these days, or trying to do so. So YouTube will be another place. I think it's the same handle. Or just search it. You can find my stuff on there.
I'll have links to
But
both
yeah,
as well below. So, yeah, I stumbled across your YouTube prepping for this, and yeah, lots of good content there. So
yeah,
I,
appreciate it.
it's great work. Well, Dan, again,
Appreciate
thank
it.
you for your time, dude. It was a pleasure getting to talk with you.
Yeah, my pleasure, Chase. Yeah, thanks for having me on.